welcome to our presentation. As a topic, we chose to do how depression was affected, or recovery of depression, from having an adequate support group. And we looked at that specifically with elderly patients, with men versus women, with the general community, and with substance abuse.
It's amazing how far you can go just because someone believed in you.
Galatians 6:2, carry each other's burdens, and in this way you will fulfill the law of Christ.
A poem by Aaron Hansen. The thing about pain is it won't last forever. It kills you right now, but with time it gets better. The thing about scars is they all start to fade until nothing is left of the cuts that were made. The thing about today is there's always tomorrow, and if you can't find your smile, I have one you can borrow. The thing about help is beside you it stands, but it won't know it's needed unless you reach out your hand. The thing about love is you can't feel its touch unless you let someone know that this world is too much.
The first article is Investigating Social Support and Network Relationships in Substance Use Disorder Recovery. I chose this article because substance abuse seems to be a prevalent issue in today's society, so I wanted to see how recovery from that is affected by social support networks. So basically this article talks about how they used phone interviews in 5 different demographic locations, and they interviewed the subjects to determine the correlation between their social support systems and substance abuse recovery. So the results determined that the people with greater support systems and willingness to use social networks like AA programs were more likely to stay abstinent from harmful substances. Personally, I learned that people who go through substance abuse often have trouble staying away from those substances. When they are going through these difficult circumstances, they can feel alone, which can result in depression and reverting to the substances themselves rather than staying abstinent. Those that feel like they have a good support group or programs are more likely to stay abstinent from those substances because they have accountability and love.
Hi, I'm Reagan, and I chose an article on the family support and depression systems over a 23-year period. Within that, they did a study of over 300 people, men and women, both with support and without family support systems, and they did a linear projection of that data over that 23-year period. They collected 5 times using DSM criteria, multiple surveys. They collected information, and that was at the initial appointment, the 2-year, 4-year, 10-year, and then 23-year period. You will see at the end of this how that looks on a linear graph, and it will clearly show you that how crucial family support is in the recovery and maintenance of depression symptoms. The males with support, initially it didn't matter, but the females, however, it greatly differed, having family support and not support, on how their depression over that 23-year period factored in. The reason why I chose this article is they used most of the women from local clinics around a couple of different areas. The men, however, they used from the VA system, so most of them were veterans who had seen combat and had already started off with a little bit of PTSD with those depressive symptoms. So that was near and dear to me, being a veteran myself. I wanted to see how support would help them in a long-term period recover, since it is so prevalent with one of the longest wars in history that we're dealing with right now.
Hi, I'm Jennie Jenkins, and the article I chose is called Leadership in Community Mutual Support Groups for Mental Health, a qualitative case study from the leader's perspective. The article focuses on an interview-based study, interviewing specifically the leaders and how they have impacted their support groups and the positive reactions that have come about their different types of support. So this mainly focuses on 3 different things. So the first one is the it's a family value. So basically like calling the support group a family and providing constant and seemingly unconditional support for the patients who are struggling with a mental illness. The second one is professional values. So using community resources and actually advancing them in their careers to give them hope and a feasible goal in life. The third one is working as a team, which is utilizing one another's strengths to provide a greater recovery skill set. And then, I chose this article because I want to go into mental health nursing. And this article provided concrete examples and evidence to provide the best support that I possibly can for patients that are struggling with mental illness.
Hello, I'm Chrissy, and my article is called Recovery from Depression in Older Depressed Patients in Primary Care. And their overall question was how the initial severity of depression and social support related to the depression outcome, or how quickly someone recovered from a depression disorder. They mainly tested for what the difference was between patients who did seem to recover well and patients who didn't have any signs of recovery. And so they took 68 adults all over the age of 60 who met the criteria for major depression, and they tested them in acute care settings by asking them different questions and doing different surveys to see what kind of support they were having. And there are two main types of support they tested for, which were emotional and instrumental support. Emotional being if they felt like they had empathy or compassion from the different people in their life. And then the instrumental support referred to more different tasks, such as giving someone rides or helping them with money or taking care of their kids. So they had 5 items measure the size of the social network in terms of 1, the number of children visiting weekly, 2, the number of children visiting monthly, 3, how many friends or relatives they felt they had, and 4, the number of at least monthly visits by friends or close relatives, and then 5, of whether or not they felt that they had a confidant. So to measure the adequacy of those social support groups, they reported if they had enough instrumental support and if they felt like they were needing additional help from what they were receiving. And they ended up choosing numbers from 1 to 6. 1 meant that they felt they had inadequate support to meet their tasks, and 6 being that they were adequately supported. In the end of the study, they found that there was no significant difference found between patients with different social supports or severity of depression. However, the patients who did improve the most had originally reported having a higher amount of social, emotional support than those who did not. I mainly chose this article because as working as a CNA, I got to see and treat a bunch of elderly patients who really felt that they didn't have adequate support systems and reported that they felt like there was no one there for them or no one they could talk to or go to for help. So this was sensitive to me, and I love being able to research it. It's also been reported that elderly patients suffering from depression have either equal to or lower functioning levels than people with chronic medical conditions such as heart and lung disease, arthritis, hypertension, and diabetes. So that's why this was a really important topic to look up to see if there's any ways we can help them if they feel they need support.
Are we still on this one? Sorry. The third one is...
I also picked a...
Oh,
I want to go into mental health nursing. What was that? Okay.
thanks for listening.